Hi, I'm Dr. Daniel Phang. I'm an anesthesiologist and a pain management specialist operating out of the Affinity Pain Clinic. We are located at Mount Elizabeth Orchard Hospital.
Hi doctor, what's a pain specialist?
As doctors, we recognize that all patients go through some form of suffering and hardship, and definitely pain. For pain specialists, we recognize that this pain is a personal and specific thing. It is linked with the patient's own emotions and experiences, and we don't discount it. Through our medical interviews, physical examination, along with any specialized imaging, we arrive at a reasonable working diagnosis, a journey with the patient, recognizing that this is pain management and not some magical cure to get rid of all the pain. Our treatments are aligned with the patients because the patients are generally looking for something that is non-surgical and minimally invasive to help with the issues.
Why is pain management a subspecialty of anesthesia?
I think traditionally, anaesthetists, as we call them in Singapore, or anesthesiologists, have always managed acute surgical pain through medication or through nerve blocks. And I think that this is an extension of this idea. So that's how we manage chronic pain or pain management. If you're asking me why did I choose pain management as a subspecialty in anesthesia, I like the idea of expanding my repertoire in managing patients and not just facilitating their surgical experience.
Thank you doctor, that's really very interesting. Dr. Phang, can you share with me what are some of the conditions you manage?
We manage a huge variety of conditions, mostly dealing with pain itself. But in summary, we deal mostly with back and neck pain. We deal with some sports and musculoskeletal injuries. Some of the more difficult conditions would be that of headache syndromes, facial pains, fibromyalgia, and one of the more difficult ones requiring a lot of family coordination would be that of cancer pain.
Dr. Phang, neck and back pain are quite common for us because we are always on the computer. How would you manage such pain?
Well, back and neck pain with any pain condition, when the patient comes in, we do a specific interview and physical examination first, because we understand that whatever imaging that they may have may not be the cause of the pain. After arriving at the diagnosis, we will briefly present to the patient three broad areas, and that is firstly medication, secondly physical therapy, and thirdly intervention. Now, our intervention are minimally invasive and non-surgical. It involves mostly putting needles and applying the therapy through the needles itself. Of course, surgical options can be discussed if the patient is agreeable.
Doctor, just for my clarification, are all pain management problems managed the same way?
Yes and no. All patients are presented with the three broad strokes that I mentioned, with medication, physical therapy, and intervention. But not all the patients get the same kind of medication, and because there are different medication indications for different kinds of conditions. And with pain management, people might think of opioids, but I generally do not give opioids for non-cancer pain. There are also a variety of physical therapy options that can be discussed with the patient besides physiotherapy. For example, some of them might ask about traditional Chinese medicine, acupuncture, chiropractic. As for intervention, we also want to maximize the benefit for the patient, so whatever we do for the patient needs to be discussed in detail. This includes the risks, the benefits, and what the patient can expect.
Dr. Phang, what would you tell patients who are suffering from pain at this juncture?
I would tell them what our tagline for the clinic is, and that is to feel better already. Now, we do not mean that in the traditional Asian sense, where some people might be suffering from pain and they get this feel better already because the pain is just so intractable and chronic and it seems to be in their head. We mean it in a better sense. We mean it because we want to help journey with the patient, to help in the pain management journey. Thank you.
Thank you, Dr. Phang.